needle. I've got plenty of space. I'm gonna take this off, okay? Got my needle. There's a nice little hole right there, which seems like magic to people, but okay? So I'm gonna just push my drug into there, okay? Once I've got my drug into there, I'm then going to carefully and very carefully, okay, move mine all the way up, okay? Okay, do you see any air bubbles? No air bubbles, okay? So I safely know, I verified my drug. I know that I have 0.2 mils of my morphine, so I verified that. I've got it nice and diluted, and then I can return to my patient, okay? And just to talk through that, to save some time, we're gonna do the exact same thing, okay? You guys remember, we washed the hub. Now in this case, let's say I wanted to use his saline lock, okay? Because he had some fluids going through here that I did not want to engage with or interact with, okay? So in that case, I'm going to do the same thing. I've flushed it, so I've made sure my IV is good. It's nice and open. I've wiped my hub. And then in the same regard, now I have a whole lot more fluid to work with. So I can talk to my patient, but I have more fluid to work with, okay? It makes it a whole lot easier when you're pushing a small volume drug like that, okay? So after that, we're gonna go through, everything would be the exact same, okay? Once again, if I did use my saline lock, I'm making sure this is nice and locked before I leave, okay? Looks good, okay? So that's now that my patient has safely gotten his morphine. Once again, I'm gonna dispose of all of my things as we've done, okay? Now, my patient had a secondary medication order. So I would go through all of the same things that I already did, right? I've gone to the computer. I've verified when I was at the Pyxis. I made sure I had the right patient. I made sure that I had the right drug. I've checked with the patient. What did I come in? I made sure that I checked his armband. I wanted to make sure I had the right patient. I've got my right drug. I want to make sure that all of that is in place, okay? Now in this case, we're going to be hanging what's called a secondary. You'll hear the words piggyback, secondary. They mean the same thing, okay? Now what May hung was called a primary, okay? That was our primary fluid, okay? So most often, by nature, you need to see the difference when you're running in and scrambling to get when you're going to go get all of your supplies, make sure that you have the right tubing, okay? What does this say on there? Secondary medication set, right? Okay, that's my secondary. You know what I think is always the easiest way because you're gonna see one of these nice little blue things in there. Sometimes they may be different colors, but they're almost always blue, okay? So you're gonna see that in there, but just make sure, because when there's putting the supplies in there, sometimes not in the right spot, okay? And like I said, it's awful to get in the room and not have the right thing, okay? So this tubing looks very, very different than this tubing, okay? So just make sure. Now, I'm gonna go ahead and turn my pump on, okay? Making sure that my pump is on. Sometimes this will take a minute. Now, one thing you guys want to be mindful of, let's say that he went to the bathroom and came in and his pump was off for some reason. Always make sure that if it's off, that it's supposed to be off. You're gonna laugh, but that happens all the time. You'll come in and the pump's off, but he's supposed to have fluids running, okay? So, oh no, he's supposed to have fluids running, and I realize that. Is he a new patient? We're gonna say no, because he's not a new patient, okay? Are we oncology? Yes, we are, okay? Now, once again, guys, this is your hub over here, okay? So this thing is beautiful. It talks to you. Select your channel, okay? So we're gonna come over to channel select, okay? And we're gonna go back so you guys can see this once again really quick. So we're doing a basic infusion, okay? We're gonna say that the orders were for the patient to have LR going at 125. We're not giving a bolus, okay? We're gonna do it at 125. So I've got my rate right here, okay? So I'm gonna go to rate, and I'm gonna do 125, okay? You see that? Volume to be infused, okay? We're gonna say that we've got a bag. I'm gonna pretend that we have a 1,000 ml bag, which is the normal thing that you're gonna see when we're hanging fluids, okay? And so I'm gonna go, I don't wanna go all the way, right? I don't wanna drain my line. So I'm gonna say, we'll say 985, okay? That's my volume to be infused. So I'm gonna go ahead and restart that because I realized that his fluids weren't going. So I'm making sure that all that's going, okay? So I've got my primary set up, okay? So the next thing we're gonna do is we're gonna get our secondary set up, okay? So I'm gonna open my supplies. I'm gonna kind of stay near the bedside. I've already verified with him. He doesn't have any allergies, so I'm not worried about any interactions there. I verified with him that he doesn't have any allergies. And I'm gonna go ahead and open up all my stuff. We're gonna be giving him an antibiotic, which we already talked about. So we're gonna give him some vancomycin. I verified that I've got the right dosage. You're gonna see in the hospital, it's very different. Some people have the bags in the Pyxis like this. Some of you are gonna get to learn how to dilute your own antibiotics and how we hang that, okay? So we wanna make sure that we've got the 100 ml bag. That's what the order said. I told Mr. Jimmy I wanted him that he was going to be getting this over an hour. Okay, so let's talk about that. I've got a 100 ml bag and I want this to go in over an hour. So what is my rate going to be? That's the easiest one, right? Whatever's in the bag, if it's is what it's going to be in an hour, right? That's nice and easy. If this was a 250 ml bag, I would give it at 250, right? We've got a 100 ml bag, so our rate is going to be 100, right? And we're going to be putting in 100 milliliters, okay? So I've got all that set up. So I like to always get this set up before I get my pump set up. So I've got my trash can over here. You guys will maybe learn about back priming, which we'll teach you about later, but in this case, I'm going to go ahead and just prime it myself, okay? So I'm going to open up my bag. And you see the blue thing in here. There's a reason that I can't open my bag. There we go. Okay. And you're going to see, guys, that in the hospital, all of them are different. At UWE, we rip from the top, and these ones we're going to rip from the side, okay? So just make sure you're looking at all these things. Okay, so the tubing does look very, very different. We've got this lovely thing right here, okay? Y'all see that? Okay? So we're going to be hanging this on our pump, okay? This is very, very, very important, and you're going to see that people still forget to do this, even though it's in the bag, okay? So we're going to do a huge transition because we are moving. We want him to get this antibiotic now, right? We do not want him to get this, okay? As when we hang this and set the pump up, we want him, this is what we want him to get. So I'm going to transition my primary bag over here, and it's going to now sit at a lower level, okay? This is a gravity issue, okay? Because this pump wants to give whatever is hanging higher, okay? So in this case, I want it to give my antibiotic, okay? So I like to do, when I'm, and you may talked about this, so I don't want to regurgitate a lot of this, but this is, as a rule of thumb, this is the part where a needle goes through, which you're not going to be using, okay? This is where we're gonna take the cap off so that we can go ahead and get this primed, okay? I am the same as her. I always, always, always close it first, okay? Why do we do that? Okay, because if it's open, know that these are always gonna automatically be open, okay? But if you do that and you stick it through, it's gonna gush through, and I want him to get every little drop of this, okay? Especially when we're hanging really important medications, they need every drop in this bag, okay? So I don't wanna risk blowing it all over the floor, which you'll be surprised, but it happens all the time. So safety measure, make sure that's all the way locked, okay? So we got that, and then, okay? So I'm gonna remove all my little things. Everybody's different. Some people like to hang theirs. I like to take it and hang it upside down. I feel like I'm not working as hard. Okay, I'm not working against gravity to get my stuff connected, okay? So we're gonna remove all of our tops, which are stale. We're gonna go ahead and, okay? And you're gonna find these little bags, you really kind of gotta work it in there, okay? You gotta really make sure that that's all the way in, okay? And then I'm gonna hang mine, okay? And then once again, we've had that locked, so I'm gonna move my trash can nice and close, okay? And these are quick, these little secondaries are shorter tubing, okay? So I'm gonna make sure that I've got my cap off, okay? And we're gonna open that line up. It's gonna be nice and quick, okay? So you wanna do that nice and quick. All right, so I see that I don't have any air in my line. I've got coming through the tubing, so mine is set up, okay? Now, where does this go? Okay, so let's talk about that. Because this is very different than this tubing. You've got this beautiful port right here, okay? Has this been open to air? Yes, it's been open to air, okay? Now, when you're doing all of these things at once, if I was setting up a primary and a secondary all at once, it's a little bit different, but in this case, I haven't. So I'm gonna get out my alcohol, okay? As usual, I'm gonna clean that hub. I know you're gonna get tired of us saying this, but you gotta do it, okay? So you're gonna do like that. And when you're in the hospital, you're gonna see you'll see some caps that people put on the end of this, but this is where this is gonna go, okay? So we're gonna connect our secondary. So I'm all connected. Okay. See how that goes. I've got my secondary up higher than my primary, okay? What is running right now? We're at 125, so we're still running our primary, okay? So it's time for us to come in and set up our secondary. Now, when you're in the hospital, you're gonna see that they make this job very easy for you. You're gonna be scanning and all of that, but in this case, I want y'all to see how we do this a little bit differently. So we're gonna come over here, we're gonna go to, we've got all this set up, okay? So I've got I know what I'm running, okay? And now we're gonna set up, so we're going to go to channel select, okay? We see all these things are coming up. So once again, it's gonna show us what we've got our primary infusion. It's going at 125. and all of that. Now I want to come down here. These are our options. You see delay options, volume and duration. I'm going to hit secondary, okay? Now in this case, I'm going to teach you how to do this all manually, okay? So I'm going to do a basic secondary. Who remembers what I said that this was going to be running in? Over an hour, right? Okay? So I've got 100 mils in my bag, so I know that I want my rate to be 100, okay? What is my volume to be infused? What's in the bag, right? So 100 mils, okay? So we've got everything set up. It's gonna tell you what to do. Verify the secondary clamp is open. Oh, thank you for reminding me it's not open, right? So read this machine tells you what to do. Okay, so verify that's open, and then I'm gonna hit start, okay? Now here's the big thing. When you start it, this little lovely thing is gonna tell you what's happening, okay? In the hospital, when you actually scan a drug or you manually put in the drug, it tells you what's going through, okay? So that's a beautiful safety measure. It'll say vancomycin, or it'll say azithromycin, or whatever's going through, it's gonna tell you what's actually running, okay? So in this case, I see that I've now switched over from my primary. It's now running my secondary, okay? And it says that, right? So I've got 100 mils, but don't just trust that. What do we want to trust? Okay? Always look at the bag, okay? Don't just rely on this machine. We turn into little robots and we just look at this and we forget, okay? Do that. Make sure, I'm gonna sit in here, make sure that it's running okay, because what are we always worried with antibiotics? Possible allergic reaction, right? We're always concerned about that. So stay with your patient for a little bit. Talk to them, make sure everything looks good, okay? We'll look at the IV side, make sure everything's still running good, okay? Once I find that everything's running good, then what's gonna happen when this secondary is done? What do y'all think is gonna happen? It's going to, resort back to the primary, okay? That's what the machine is gonna do. Once this, in an hour, when he's finished getting his vancomycin, it's gonna go back to this. So when I come in here, it's then gonna say 125 and it's gonna tell me what's running, okay? So that's how we run a secondary. Same thing when we've done that, we've verified, I've made sure he's tolerating it okay, his IV site looks okay. I always like to come in when an antibiotic's done just to make sure that they're doing okay, and we can check their vital signs, make sure they're doing fine with that, okay? That should be everything. All right, Mr. Jimmy, you still doing okay pain-wise?
Yeah,
awesome.
Feeling good.
Okay, well, I'm gonna be back in a little bit. Make sure you're still doing okay with this antibiotic. You let me know. You have that call light right next to you, right?
Mm-hmm.
All right, I'm gonna make sure these bed rails are raised. I'm gonna have that bed down to its lowest position possible. I'm gonna make sure he's comfortable, or does he need blankets, okay? All right, I'll be back in a little bit, okay, Mr. Jimmy? All right, I've disposed